Insight. And we're turning our attention to a fairly concerning new global study about teenage smoking, because experts are sounding the alarm over a pretty troubling trend, a rise in vaping among teenagers, and for the first time in a decade, an accompanying rise in youth smoking. Now, researchers at Penn State University in the USA found teenagers who vape are as likely to smoke as their peers were in the 1970s. With a third of teens who vape also using cigarettes. The figure for cigarette use in non-vaping teenagers, by comparison, is about 1.5%. So it's a pretty staggering difference. Now, we've got no specific figures for teen use available here in the UAE, but Dr. Andrea Limburger-Jabari, who is Assistant Director of Tobacco Research at NYU Abu Dhabi, says we do know that people here who use vapes often use multiple tobacco products.
People who interchange using e-cigarettes or vapes with cigarettes or combustible tobacco. And so even that, I think that's also an area of concern, because people use both products usually at the same time. And so if you think about nicotine dependence, it's quite possible that, you know, we're looking at trying to use traditional methods to measure nicotine dependence, but it's quite possible that we may need to think about newer ways to measure this nicotine dependence, because these different products deliver nicotine in different ways. And if people are using them at the same time, that's a cause for concern.
A cause for concern, but why and how concerning? I am joined now in studio by Dr. Rachel Kaminski. She's a consultant pulmonologist at Saudi German Hospital here in Dubai. And Dr. Rachel, I mean, this study, first of all, it suggests a very clear link between vape use and cigarettes. And we hear Andrea there saying we know that this is something that we see here in the UAE. Why is that kind of dual use particularly concerning?
I think people will interchange depending on which social situation they're in. And whenever I'm taking a history from a patient, I will say, do you smoke? And they'll look at me and say, no, I don't smoke cigarettes. And then I say, do you use any other tobacco? Do you vape? Do you take shisha? Do you use IQOS? And normally, most of my patients are telling me yes, and using, you know, multiple devices at different times. And alarmingly, actually, younger people really feel like vaping is a very safe thing. Shisha is very, very safe. And then as I'm speaking to people in their 20s and 30s, they say, you know, yes, I used to vape, or I used to have shisha, and now I'm taking IQOS because that's better for me, or I'm smoking an occasional cigarette because that tastes less good, so therefore I do it less. So people have some quite strange habits and ideas about how safe things are, and interchanging between all three of the tobacco-containing devices.
Forgive me, I don't know what IQOS is. What is IQOS?
So that's an electronic cigarette. So it's not. It actually, you put a little mini cigarette into like a device, and then they smoke that. So it's kind of between vaping and cigarettes.
Oh, okay. So sort of halfway between the two.
Yeah.
Interesting. I feel like I learn something about some new technique every time we have conversations around this issue. Before we move on, I wonder then, this study is looking specifically at teenagers, and I wonder, have we been aware up until now, sort of beyond the anecdotal evidence that you see in clinic, that there is a link between teenagers vaping and teenagers smoking cigarettes? Is this something that we knew?
So I think we were concerned about 5 years ago when the move from trying to get people off cigarettes to say maybe you can vape, you can use other tobacco containing devices to get off that. But then obviously vaping became quite trendy, quite fashionable, all the different flavors, you know, you don't smell disgusting anymore, readily available. And then you could see that this was going to become a trend for the younger generation. So I was in the era when I was at school that cigarettes were cool. And then in my 20s, 30s, they became very uncool. And now obviously vaping and shisha, and actually now cigarettes are sort of coming back into fashion and seen as more socially acceptable and like a cool thing to do. And the worrying thing is that when younger people smoke or have nicotine, that affects actually the front part of their brain, the frontal lobe, and they're more likely to develop other addictions. And you can therefore see how that will lead on to potentially thinking it's okay to have cigarettes. And then we know all the really serious consequences of that, let alone now we're starting to see in mouse models and animal models the effect of vaping on lungs. We know that it's going to be linked to cancers and COPD from animal studies, and we just haven't got the long-term data, but we can see that it's damaging and dangerous.
And with those kind of risks, would you expect them to be different for people who are starting in their teens? Are you more susceptible to the health risks when you're younger, or is it just a case of having a longer period for the sort of cumulative effects to take effect?
That's a fantastic question. So both. So you're having a longer duration of having the smoke, the oxidative stress on the lungs. But actually our lungs, from the moment we're conceived till about the age of 19 are developing.
Oh, wow.
So we want our lungs to reach their full lung health, their full lung potential. And if you think anything that happens in childhood, so any serious pneumonias, obviously inhalation from fires, smoking, vaping, it's all going to damage them and they're never going to reach their full lung potential. So we're going to be left with a generation in their 30s, 40s, 50s that are already now starting to lose lung, as we all do, from the age of about 20, but they never got to where they should have been, and that rate of decline, if they carry on smoking or vaping, is going to be at a much faster rate. So we're really in for a bit of a serious consequence of these patients and these people having different lung pathologies like asthma, COPD, lung cancers, scarring of the lungs. So it's really concerning and worrying.
I mean, you mentioned the smell a minute ago, and, you know, like you, I grew up, it was sort of cool to smoke, and lots of us tried it when we were teenagers. And I remember going home and my parents going, hang on, what's that smell? Because it was so clear, I think, to the adults in your life. If you'd been around kids who were smoking, if you'd been smoking, you could smell it on you. And I wonder now for parents who maybe have teenagers who think that their kids don't do these things. And of course, it's not as easy for them to spot it. What are the signs they should be watching out for that their teens might be using vapes?
So I think it's really difficult. As you said, there's no obvious telltale signs. We used to come home and used to reek of smoke. And if we'd been in a nightclub, we couldn't hear either. So it was all the consequences of that. But now it's very easy to hide. They're small little devices. They can leave them at friends' houses. They're the same chargers that we use to charge our phones. You know, it's difficult. I guess behaviour changes if your teenager's getting maybe moody, if they've not been out or been away from you. Potentially this could be like a nicotine dependency, and just being honest, asking them, saying, look, you know, there are some things that are out there, potentially they could be causing you harm. I'd much rather you tell me about it and we be open and have honest conversations about it. It's really hard. I mean, I've got a pre-teenager and I'm just going into that era. So I think it's very difficult to know.
I mean, I'm the same. My son's still sort of at primary school, about to start high school. But it does sort of scare me that those things that we traditionally would have thought of as being real warning signs that teenagers are experimenting. I mean, I suppose at that age, it's normal that kids experiment, but it's a lot harder now for us to know what they're getting up to. I think when we were kids, it was a lot more obvious.
Afternoons on Dubai Eye 103.8.
A new study found teens who vape are about 30 times more likely to smoke cigarettes than their non-vaping peers. It's a very clear link, and it's probably got experts very concerned. But interestingly, it also comes at the same time as different research suggests there might be reason for hope, because after years of growth, teenage vaping in Australia has turned a corner. New data from the Australian government shows a really sharp drop in youth e-cigarette use after legal reforms introduced there last July made it much, much harder for young people to buy vapes. But what's really interesting about this study is that a lot of the young people surveyed now say they see vaping as embarrassing rather than cool, which kind of raises some questions about what's working and whether there are things there that we could learn from. I'm still joined by Dr. Rachel Kaminski. She's a consultant pulmonologist at Saudi German Hospital. And Dr. Rachel, I wonder, first of all, what stands out to you about that reported drop in teenage vaping rates in Australia?
I think it's a really well put together study, and obviously there was an intervention. There was, they saw it as a serious detrimental health risk to their younger population, and they were very serious. They brought in strong legislation, rules in schools, people that were younger than 18 needed prescriptions. I can't imagine writing a prescription for a 17-year-old to vape, but they made it very difficult, and the consequences were there. You would get fined, you'd get kicked out of school, your families would be informed, you'd have high fines, and they enrolled lots of very eminent people within society to kind of change the perception that it wasn't without its risks. I think they showed images of 19, 20-year-olds that ended up with popcorn lungs, so lots of holes in their lungs from vaping, and saying, you could end up with an 80-year-old lung after 6 months of vaping. So they did a very strong media campaign. Then they went into schools and they got the right people behind it, saying the right things. And it is really positive to see that there's been a downward trend, finally, for the first time in something that's just been increasing throughout the world.
And as you say, there's so many different sort of threads to that picture in Australia. It's really hard to sort of pull on one and say this is the thing that's changed it. But what I thought was really interesting was that change in perception, the idea that vaping is an embarrassing thing to do rather than a cool thing. And I wonder, when you see young people in your clinic here in the UAE, what do they think of vaping? Are they quite open if they're doing it? Do they still think of it as being something that's quite cool or quite normal?
It's seen very normal here to smoke. So, I mean, maybe I'm getting a slight warped sense of it because people are coming to my clinic because they have respiratory symptoms. Yeah. But, people are very happy to tell me that they smoke, how much they smoke, that they're vaping. Particularly young people see it as something without risk. So, there's no real shame, really, I've seen in smoking, or thinking that it's uncool, or that it actually is dangerous to you when you're in your late teens or your early 20s. It's seen as something that's kind of risk-free.
And as you say, you're seeing people who are perhaps already feeling the effects of it. But when you see younger patients, do they tend to believe that this is being caused by vaping or by smoking or other tobacco products? Or do they tend to think, oh, well, it's something else? Are they quite amenable to the idea of giving up?
So I think you can be quite clear, and, we can do tests on them and say, look, your airways you're breathing something directly into an airway that's just supposed to breathe air in and out, and that's causing inflammation in your airways. And this number tells me what your inflammation is, and this number tells me how narrow your airways are, and this number tells me that actually when I give you medication, this is what they're doing. So it tells me that your airways are hyper responsive and they're irritated by something, and what has changed recently has been this. So therefore this is likely to be the trigger for you, and if you do not stop, then this will go from being something that we can reverse with treatment, and hopefully that you won't have as a lifelong chronic condition, to something that will be irreversible, that despite the best treatments we have, you're going to have deterioration in your lung function. So if you explain it in a way, and you can talk to them about different size airways and what's going on and how things are affected, and you can see smoke, that that's obviously not something good to breathe into your lungs. So they are receptive, but they haven't really thought about it until you've highlighted it and said that's why you're coughing. You're coughing because your airways are inflamed, or you're coughing at night because you've now developed like a mild asthma secondary to this irritation that's coming into contact with your insides, causing this problem.
What I find really interesting about the vape conversation is that when vapes were first introduced, they were sort of sold as being healthier than cigarettes. And, we're talking about prescriptions. They were often, advised by doctors to people who maybe were heavy tobacco smokers because they were a safer alternative for a period of time to help people give up. I think what's really interesting is that it's almost as though the pathway has flipped. So we're now seeing young people that are starting out with vapes and moving on to cigarettes. And I wonder how much of that is down to this messaging where we led people to believe that vapes were healthy rather than being a healthier sort of path away from smoking altogether.
Yeah, I think the messaging wasn't clear at all. And I think also, there's the young mind perception that actually you're pretty indestructible when you're in your teens, when you're in your early 20s, and things that you do then won't have ongoing consequences. But imagine drinking heavily every day or eating high-fat foods every day for a period of 5 years. That's going to affect your health. That's going to harm you. So you kind of have to look at it in that respect. And I think as well, we haven't had those nicotine replacement products. They weren't legalised here. So things like inhalators, things like the gum, things like the patches, and a real drive to actually stop smoking until fairly recently. And actually, we're now seeing the importance of that because we know that smoking is the biggest cause of preventable deaths worldwide from respiratory and heart problems. So it's something we really need to tackle.
And of course, part of this picture is the people who are moving from vaping. They're introducing cigarettes, but they're probably still vaping as well. Maybe the people who are coming to you who say, I don't smoke, but then they're using 3 different types of sort of non-cigarette tobacco products. What is the difference in terms of the potential damage when people are using multiple different items rather than, I want to put just in inverted commas, but rather than just cigarettes or just vapes?
So cumulative effects will all come together. So I explain to my patients, so if you smoke shisha, that's like smoking, if you have one shisha, that's like smoking 120 cigarettes. So patients that do that very infrequently, like once a month, their lungs then generally recover and are okay in between times because they're not having that ongoing stress. Somebody that then will smoke shisha once a week, will smoke cigarettes a couple of evenings a week when they've gone out with their friends, and then pick up vaping when they're a little bit bored, are having that ongoing high level of stress to the airways. And you can just see that in 5 years' time is going to result in them having permanent damage to the lungs. So, historically, it would be intermittent shisha or intermittent cigarettes, and now it's all coming together, and actually it's much more detrimental. And if you think about throat cancers, the actual cigarettes, if you think about how much you have to inhale if you're vaping, that takes a bigger inspiratory effort. So then maybe they'll be inhaling more, and actually that's going to cause more tar deposition on the back of the larynx. So you can see how potentially these things are all going to come together, and we're going to be in a very tricky situation very soon.
So I've got 1 minute left with you then. If there was one message you could send to younger people who are vaping at the moment, who are maybe considering trying cigarettes or shisha, what would that message be? I assume there isn't a harmless way forward.
So everything in life is a choice, and you come to my clinic, I'm not going to judge you, I'm not going to tell you off, but I will tell you the damages that you're doing to yourself, how choosing alternative things, giving a healthy body, healthy mind will mean that you'll live a much happier, healthier life, and really say that it is a slippery slope, and that it means you're much more likely to end up smoking cigarettes, which we really, really don't want for you.
Thank you so much for your time. That is Dr. Rachel Kaminski. She's a consultant pulmonologist.
Afternoons on Dubai Eye 103.8.
And we are staying with